Now at 11, it's the first step toward reopening Oregon's economy, but some worry it may be too soon and put workers at risk. Plus, the pandemic causes a sharp drop in emergency room visits, but not for the right reasons. And Oregonians sound off on their support for stay-home orders and what they think we'll need to get back to normal.
This is KGW News at 11.
Good evening. Thank you for joining us. I'm Laurel Porter. First tonight, many of you may head to the grocery store this weekend. If New Seasons Market is your preferred choice, it'll be one of the last times you're allowed to shop without a face covering. New Seasons will require all customers and vendors to wear some sort of mask inside the store. KGW's Mike Benner has a reaction from customers.
Friday evening at the New Seasons on North Interstate, you'll find plenty of customers wearing face coverings.
I'm not sick or anything, but I just wanted to make sure I didn't get sick or I didn't pass on anything if I was unknowingly carrying it.
He's wearing a mask voluntarily, but soon it'll be mandatory, just like it is for employees. Effective Wednesday, April 29th, all New Seasons customers 2 years and older will be required to wear some sort of face covering. Vendors too.
I think it's a safe idea. I think that it's good to keep the workers safe because they are really doing us all a big favor.
I think that they care about people and they're showing it. I think it's a good idea.
Safety inside grocery stores has been top of mind for weeks, but perhaps it's never been more important than it is right now. Just days ago, Whole Foods Market announced that one of its employees at the Pearl location died from COVID-19, and a worker at the Hollywood store tested positive. You may recall Fred Meyer on Northeast Gleason has had a worker come down with the virus, and 3 employees at 2 different Winco stores in Oregon.
You're going to see those cases popping up more and more and more.
Dan Clay is the president of United Food and Commercial Workers Local 555, representing thousands of grocery workers in Oregon and Southwest Washington. Clay is well aware of the COVID-19 precautions inside local stores. Among them, Safeway has stepped up its disinfection protocols. Albertsons is encouraging social distancing with one-way aisles, and you'll find plexiglass shields at the check stands. Fred Meyer also has those plexiglass shields. Additionally, they're urging employees to wear masks and limiting the number of customers in the store at one time.
Everybody's taking some steps, and some stores are, out front of others.
No doubt. Just look at New Seasons. In just a few days, all vendors and customers will be required to wear a mask, like the employees already do.
I think it's good.
The big question is, will other grocers follow suit and mandate face coverings for customers? Only time will tell.
I think it's a good idea.
Again, these new measures go into effect Wednesday, April 29th. And New Seasons wants its customers to know that while supplies last, they will be offering masks at the door for any customers who might not know about this policy or may have forgotten their face covering at home. I'm Mike Benner for KGW News.
And it's not just grocery workers who are worried. We're starting to hear from some dental offices concerned over reopening plans. Non-essential procedures are set to begin again next week in Oregon. A few workers have emailed us saying they worry about the close contact with patients and that it will be impossible to avoid infections if a person with COVID-19 and no symptoms comes into the office. Emily Robertson works at the front desk of a dental office in Portland.
I feel like this is worse than every other virus. It's worse than the flu. It lives in your droplets, and using a high speed, ultrasonic on your teeth, that flings all kinds of debris everywhere, and you can only wipe down so many surfaces.
That was the main complaint we heard from others as well. The Oregon Dental Association said it is working with the Oregon Health Authority to draw up specific guidelines to help dentists open safely. Local doctors and health officials say there has been a sharp drop in ER visits during the pandemic, but that's not really a good thing. They say it's because people are ignoring clear signs of serious problems like heart attacks or strokes because they're afraid of getting coronavirus at the hospital.
We've had people who have obviously had very significant strokes, very, very obvious symptoms, who only came in days later because then they had a fall and broken arm because part of their body wasn't working right because of the stroke.
Hospitals in our area have seen anywhere from a 20 to 50% drop in ER visits since the pandemic began. Doctors say ERs are safe and that if you suffer a serious health emergency, you shouldn't delay seeking help. Meantime, we're learning more about the findings and methodology behind a survey from earlier this week that found most Oregonians support stay-at-home measures. Galen Etlin spoke with one of the researchers who helped put it together.
When you see rallies like this, people defying stay-at-home orders, it's easy to get an overinflated view of how our communities actually feel. And some nonpartisan research groups say, take that with a grain of salt.
Frankly, the more politicians are out there in front, the more divided we're going to be.
Survey results this week from DHM Research show 82% of Oregonians support staying at home. Democrats and Republicans, Eastern and Western Oregon included.
And I think that's something that's really caught people's eye. So more than 70% of Oregon Republicans support the stay-at-home orders.
A lot of you are texting KGW about this issue and about when things can really open up. And most agree. This viewer says, I won't feel safe until there's a safe, effective treatment or vaccine. This virus isn't going anywhere just because we want it to. Another guesses that will take 6 months to a year. Someone else says, I'm never going to feel safe again. But others, like this one, are ready for it as soon as possible. And the survey shows it depends for people where you're trying to go. Most think you could get a haircut in a month or two, while going to a restaurant, mall, airport, or sporting event will take 3 to 6. And this all tells a bigger story.
We're seeing a ton of political views, at least in people's online comments.
Yep.
What can be done, do you think, to sort of bridge those divides through this data?
I think as best as we can have consistent information coming from trusted public leaders. And on COVID, that's not really as much the electeds because they carry so much baggage from everything else that we feel about politicians, but really our public health officials.
So what's the solution? Most Oregonians say better and more widespread testing. And DHM Research says we also need more context and more data.
Leaders need to understand what the public is thinking, not making guesses, not going from their gut, not by comments on a website, but sort of real perspective.
In Wisconsin today, nurses helped put together an anti-protest at the state capitol. It's in response to recent pushes from people who want to lift coronavirus restrictions now. The nurses put lit candles on the Capitol steps. Each one represents a person who's become sick or died from coronavirus. Supporters of this anti-protest say people need to continue to stay home and listen to health experts.
Our health and our economy go hand in hand. If we take risks by opening the economy too early, we will see a spike in cases. We're going to end up taking steps backward rather than forward.
More than 50,000 people have died from coronavirus in the U.S., with more than 900,000 confirmed total cases. Today, Walgreens opened one of its first coronavirus testing sites in Oregon. The drive-through test is available in Hillsboro, but only for patients who complete an online health assessment and meet eligibility standards. Walgreens pharmacists will oversee the test. For more information, visit walgreens.com/COVID-19 testing. As expected, President Trump signed a nearly $500 billion relief bill this morning. It passed the House yesterday, following the Senate earlier this week. The deal includes more than $320 billion for the Paycheck Protection Program, which helps small businesses with loans. About $75 billion will also be set aside for hospitals and $25 billion for COVID-19 testing. We've heard a lot about how difficult navigating Oregon's unemployment system has been, in large part because of the crushing demand, but it is making progress. Tim Gordon shows us how it's improving to help a group of workers who normally wouldn't get unemployment benefits.
Think of all the people who basically work for themselves, from Uber drivers to freelance workers of all kinds to people who provide us services, like Veronica Suela, who cuts hair.
I've been a Rough Cut for 22 years.
Veronica's last day of work at Rough Cut in Northwest Portland was March 22nd.
It's scary because obviously, if we don't go to work, we don't make money. And there's no other resources except for what they've set up, which I believe is just like inventing the wheel for us.
People like Veronica typically don't pay into unemployment, so the system isn't set up to serve them. The federal government has now told states to find a way to get unemployment and stimulus money to people like Veronica.
And so every single state, including Oregon, has had to create a program from scratch to be able to get those benefits to them.
The unemployment benefits start at $205 a week. They could go up from there to as high as $648 a week based on tax information. In the short term, people will also get the $600 a week federal unemployment payment on the top of the state money. It's been tricky to get the program integrated into Oregon's old online system, but they're testing it now and planning to have it accepting applications by the end of April.
And it is important to know that even though it has been a wait to get in to that system for the self-employed and the 1099 and the gig workers, they will receive retroactive benefits for every eligible week once their benefits are coming.
Veronica Suela feels fortunate. Some longtime clients have offered to help.
This has actually been the upswing for me, the humanity. And I mean, because they know that it's difficult.
But for her and the thousands more in the same boat, the government aid can't come soon enough.
And I'm grateful for it. But in saying that, you still have bills coming in, you know, and you're still an independent contractor.
Yeah, a lot of states are struggling with this, but again, Oregon should be up and running in a week. And by the way, I checked with Washington State as well, and they are already online, ready to help the self-employed. Tim Gordon, KGW News.
Coming up, returning to the great outdoors, Oregon starts to work on a plan to reopen recreation. A look at how that might happen. Plus,
the fact that now is such a great opportunity is pretty important.
And they're definitely taking advantage of that opportunity. How some local high schoolers are helping bring coronavirus relief to their communities.
And I'm Matt Safino. Yes, we have a weekend on the way that will begin rainy, but not all will be wet. We've actually got a lot of dry time on the way. We'll time it out for you.